Yeah, thanks for the introduction. Hi everyone. Today I'll be focusing on pregnancy complications through the lens of digital health. So for the agenda today, I'll be focusing on a little introduction about why we're here today, and also talking a little bit about my internship. And then for the second and third agenda point, I'll be going over my deliverables. And then the fourth will be discussing about what I'll be doing moving forward. And then finally, we can end with a Q&A session. So let's begin with the introduction. So I'll start with talking a little bit about my inspirations as well as interests. So as was mentioned before, I do hope to be an OBGYN in the future. And so I was hoping to have an internship that is focused on women's health. And then I was also really interested in how we could leverage technology. And this was spurred by a interaction that I had with a patient while I was shadowing a physician. And this particular patient had an emergency delivery a few days prior to the visit. And it was during that time that I was able to see some of the frustrations and also some of the confoundment that she had um, while and also after she visited the ER. Because of some of the concerning symptoms that she was having, she decided to visit the ER. And unfortunately, the staff there, ignored what concerns she had and also told her to go back home. And so at the end of the day, the physician had to advocate for this particular patient so that she could be admitted. And it turned out that the emergency delivery that she had days prior was actually an explanation as to why she was having some of those symptoms. And so I was really interested in seeing how we could leverage technology to have a more objective means and approach to patient care rather than relying on some subjective opinions or view. And so this is why I was really interested in this internship. And my internship advisor was Randall Blanco. And I worked with the Perinatal Research Service Center, as well as the Collaborative for Maternal Infant Health, and also the School of Medicine. And so I'd like to go over briefly the deliverables that I did. It was primarily two. The first one was the literature review deliverable, which comprised of 4 different sections. And then we also had the perinatal deliverable, which comprised of 3. And I'll be going more into detail in this presentation. Let's begin with the literature review deliverable. I'd like to start with the approach that I had to this literature review. I did 4 modified literature review, and each of them had 6 papers, and they all came from PubMed. I also wanted to have a top-down approach to each of the literature review, where I had 1 or 2 papers just provide like a general scope on the topic of interest. And then the rest of the papers will have a more specific discussion on the topic, discussing a more narrower niche. And then I also had a type of miniature screening process. And generally, as long as the paper was published in 2017 or later, and it was written in English, it was included in the review. I didn't include any gray literature or thesis or registry. And so moving on to the topics that I did the literature review on, I first did a review that went over the different risk factors for pregnancy complications. I then moved on to looking at what types of artificial intelligence tools have been developed within obstetrics psychology. And then I moved on to looking at a specific artificial intelligence tool, which is called a clinical decision support system. and looking at how it's been used during patient care. And then finally, I also wanted to touch upon what were some of the challenges to developing, implementing, and also integrating these types of tools within patient care. Okay, so starting with the first literature review, where I focused on identifying the risk factors for pregnancy complications, I primarily did this one first because this will give me the understanding of what were some of the factors that are important to consider when we're looking at these type of complications. And so it's a well-known fact that maternal mortality is a growing concern in the US. We've continued to see countless of many different types of stories coming out in the news of how dire the situation is. And so while I was, perusing through the papers, I saw that these risk factors typically will fall into three different types of categories. We have the first, the social determinants of health, then the medical history, and then also system level issues. I also wanted to identify these risk factors at different levels. So we have three primary ones, the ones at the population level, then the neighborhood level, and then also the individual level. If we go to the population level, we see that obesity, diabetes, a lack of high school education, African American race, fewer than 10 prenatal care visits, as well as the revised death certificates were risk factors that were identified. And we also see that these predictors were able to explain 91% of the increases in maternal mortality rates between 1997 and 2012. If we look at the neighborhood level, we also see that people living in neighborhoods with a higher percentage of minority populations, violent crimes, renter-occupied housing units, housing violation, women who did not graduate high school, and also women who are receiving public assistance were more likely to have a risk for maternal mortality. And then if we go to the individual level, we also see that raised cesarean birth, stillbirth, preterm birth, and also preeclampsia were risk factors that increase the risk for maternal mortality. So here we're able to see that there is a clear disparity in terms of what the risk factors are for pregnancy complication, and that continues to underscore the need for more programs, treatments, and interventions that alleviate these disparities. If we move on to the next literature review, I focused on what are some of the tools that have been used that are artificial intelligence based within obstetrics and gynecology. And I specifically wanted to do this literature review because of the interest that I have. I wanted to see so far what are the different tools that are being leveraged to improve patient care. And so that will then help me identify any gaps and potentially allow me to, you know, get involved in innovative projects and research. So as you can see here, and also as I mentioned previously, health disparity is a major concern within obstetrics care, and AI is one of the powerful and promising tools that can be used to not only improve health outcomes, but also lead to new approaches for prevention, risk mitigation, and also the optimization of treatments and resource utilization. So here on the screen, I have three different examples. The first one being the fetal heart monitoring. And we see in one study that AI was used to monitor fetal heart rate, and that was by analyzing cardiotocography. And from that, they were then able to predict future outcomes for the fetus and the mother. If we move on to the next one, we see that one study was able to use AI tools to manage gestational diabetes in patients. And so this was a platform that was developed that could not only monitor gestational diabetes, but it was also able to do that remotely. And the way it works was that the patients will upload their information, and then dietary recommendations would be provided to the patients, and any type of insulin and therapy recommendation will also be provided to the physician. And so we're able to see that this type of platform was actually able to reduce clinician evaluation by 27%. And then it was also able to reduce face-to-face visit by 89%. If we move on to the next study, we see that natural language processing was used to analyze unstructured data within the EHR, specifically the history and physical section within the EHR. And what they were able to do was take these unstructured data from different patients, and then they developed an algorithm that associated word frequency to a specific outcome, which was severe maternal mortality. And then they were able to stratify patients based on those word frequency within the admissions notes and determine which one were low risk and high risk. So here we're able to see how powerful some of these tools are in being able to not only identify troubling situations with a patient, but also provide some interventions that could improve health outcomes. So for the third literature review, I focus on a specific type of AI tool, which is called Clinical Decision Support System. And I wanted to see how this was utilized during the care. And I was specifically interested in this tool because this was something that I was actually hoping to develop for my perinatal deliverable. So I wanted to ensure that I had the information that I needed to be able to be successful in that. So as you can see on the screen, there are many different benefits to utilizing such tool. First, it's able to provide alerts upon detecting alarming values. It's also able to provide reminders for certain types of procedures that are necessary. And then it's also able to provide any types of advice or recommendation. And so this is how we can see that these types of tools can optimize clinicians' time and also identify any type of high risk situation. And so there's two examples that are here on the screen, and we see that this CDSS was used within the rural area in Tanzania. And we are able to see that this type of tool was able to provide guidance and clinical decision support during the care throughout the pregnancy and also postpartumly as well. We're also able to see that this type of tool was able to detect high-risk patient and also track the different types of activities that were taking place. If we move on to the next example, we see that this type of tool was utilized for ectopic pregnancy. And we're actually able to see that this tool served as a guide, as a teacher for the operators that were hoping to identify a pregnancy of unknown location. And so what it did was it suggested to the operator different types of views and captures and signs that it should look for, and also different types of images that should be taken so that the system is able to identify the pregnancy of unknown location and also guide the operator as well to know what are some of the things to look for when identifying the locations of different pregnancy. And so here we're able to see not only how powerful some of these tools are, but also how some of these tools can be leveraged to improve the performance of hospital staff, clinicians, and also how it's being used to improve health outcomes. So finally, my final literature review focused on what are some of the challenges of developing, implementing, and integrating digital health related tools in patient care. And I thought that this was an important um, focus because there's, you know, the aspect of creating the tool, but there's also the aspect of ensuring that the tool is efficient. And the way to measure efficiency is to ensure that people are actually utilizing the tool to improve health outcomes. If at the end of the day, a tool is created and nobody's using it, then that defeats the whole purpose. So it's important to know what are some of the obstacles that could impact the successful deployment of some of these tools. And so that will require identifying, monitoring, and also finding ways to mitigate some of the biases and some of the concerns that patients and providers who are the primary stakeholders may have. And so if we start with bias, we see that there's many different types of issues that can come up, and I'll focus on two today. The first one has to do with non-random missing data. And this is an issue that can be resolved by including more individuals from underrepresented communities or by simply adjusting the weights. And this will primarily be done during the development of the algorithm. The other issue has to do with the lack of interpretability of AI models. And the way to resolve this issue is to utilize similar technology to the deep Taylor decomposition, where it actually showed which risk factors um, were made in the contributions to the final decision. If we move on to some of the concerns patients and providers have, starting with the patients, we see that 88% of them believe that these type of tools would help improve health. We see that another 50% of them also downloaded a pregnancy-related app. And then we also see that 42% of them had no privacy concern about their data being stored. If we move on to the providers, we see that 75% of them were concerned about adding more devices to their already hectic workflow. About half of them were had the belief that more devices would actually should actually be utilized in patient care. But when we look at how many of them actually utilize these type of technology, whether that be mHealth or wearable sensor technology, we see that only about 7% of them use these tools. And so what we can see here is that despite the fact that there is some consensus that these tools are helpful to improving health, we see a contrast in their behavior where few of them are actually utilizing these tools. And so there seems to be some type of hesitation. And these are some of the things that need to be taken into consideration when creating tools. And it's necessary to include these stakeholders during the development, implementation, and integration of these tools so that we're actually creating tools that will be effective and useful, and at the end of the day, improve health outcomes. So that's the end of my literature review deliverable. I'll be starting with my perinatal deliverable. So if we, so here we can see that there's three main steps to this deliverable. I first did an exploratory data analysis where I used a publicly available data set. And then I also developed the algorithm, and that was the multi-layer perceptron algorithm. And then I also created a clinical decision support tool, and that was used to predict maternal risk for pregnancy complications. So starting with the exploratory data analysis, this was a data set that came from the UC Irvine Machine Learning Repository, and it's comprised of 6 predictors. So that was maternal age, systolic blood pressure, diastolic blood pressure, body temperature, blood glucose level and heart rates. And then we also have the outcome of interest, which was risk level for pregnancy complication. The data set also comprised of 1,014 patients, and we see that 40% of them were low risk, 27% were mid risk, and then 33% was high risk. I also did a bivariate analysis between each predictor and the outcome of interest. So beginning with the diastolic blood pressure versus risk level, we see that there is a positive correlation between diastolic blood pressure and risk level. So that means that the higher the blood pressure, the higher the risk for complications. And we see that there's, for the mean, there we have 85, 72, and 74 millimeters of mercury was the mean for the different high, low, and mid-risk groups. And then we also have the difference in the mean was significant, and there was a medium effect size. If we move on to the systolic blood pressure, and looking at the association between it and the risk level, we also see a positive correlation. And this means that the higher the blood pressure, the higher the risk of these complications. And 124, 105, and 113 millimeter of mercury was the mean for the high, low, and mid-risk group, respectively. And here again, the difference between the mean was significant, and there was a large effect size. If we move on to the age and looking at its relationship with risk level, we also see that there's a positive correlation. And so again, the higher the age, the higher the risk for these complications. 36, 26, and 28 years old was the mean for the high, low, and mid-risk groups, respectively. And here again, we have significance in the difference in mean and a medium effect size. If we move on to the glucose, the blood glucose levels, and also how it relates to the risk level, we see again that there's a positive correlation. And so that essentially means the higher the glucose level, the higher the risk for such complications. And we see that 12, 7, and 8 millimole per liter was the mean for the high, low, and mid-risk group, respectively. And here again, we have significance in the difference in the means and also a large effect size. If we look at heart rates and its relation to risk level, here we have a slight positive correlation. And so the mean was 76, 72, and 74 beats per minute for the high, low, and mid-risk groups, respectively. And we also see here that there was significance in the difference in the mean, but this time we had a small effect size. And so here we have a similar situation. There's a slight positive correlation between body temperature and risk level. And as you can see, the temperatures are quite similar between the high, low, and mid-risk groups. And so while there was significance in the difference in the mean, it did have a small effect size. So if we go over to the heat map, we see that the correlation between each predictor and the outcome is what we found in the bivariate analysis that I discussed previously. We also see that the systolic and the diastolic blood pressure are strongly correlated, which is not surprising. And then we also see that other pairs of predictors are either moderately, weakly, or negligibly correlated. So here I'll be discussing more about the multi-layer perceptron algorithm. And I'll briefly discuss what this algorithm is about without going into any of the complicated math or any of the complicated topics, but essentially this is a deep learning algorithm that can be developed by training the algorithm with your data set and also evaluating its performance. And so I decided to use this specific algorithm because many of the papers that I read through for the literature review actually utilize this algorithm. So I wanted to see how well it did with the data set that I have. So talking a little bit more about how this algorithm was developed, I used Python programming and specifically the scikit-learn library, which is typically used for any type of machine learning analysis. I also split my data into 80% for training and then the other 20% for evaluating its performance. So if we look at the results for the algorithm, I first started out with unscaled data. And as you can see, it doesn't perform well for on average and also for the different classes. And a good rule of thumb when we're looking at the area under the curve of the receiver operating curve is also called AUROC, but we're specifically interested in the area. And so a good rule of thumb for this is that if you have an area between 0.5, that is 0.5 to 0.7, that's considered poor performance. 0.7 to 0.8, that's considered okay performance, and anything above 0.8 is considered very excellent performance. And so as we can see, the algorithm doesn't do well with unscaled data. So I wanted to see how well it would do if we standardize the data. And we see that it does actually improve on average. We're reaching the okay performance range. And the same for class 0. For class 1, there's still more improvement that can be done. And for class 2, we're reaching the very excellent region as well. So I like to focus on the clinical decision support system and just provide a brief summary. As I mentioned previously, these are tools that can be utilized to augment the decision-making situation for different patients. And I specifically wanted to create this tool because I was interested in seeing how this specific AI tool could be leveraged in improving health outcomes. And so in terms of how I developed it, I again used Python for this, but specifically the tkinter library. And this is specifically a library that is used to create GUI applications that users can interact with. So if we look here, I have a demo. And so essentially the user will enter will enter all the information, the age, the blood pressure, the glucose level, their temperature, as well as their heart rate. And once the user is done doing all of that, then they'll be able to click on compute and see the risk group that the patient falls under. And so in this situation, we see that this specific patient falls under the high risk group. And so this is a tool that can be utilized to help physicians then start, planning ahead proactively to provide a more timely care to this patients as well as their other patients. So that's the end of the perinatal deliverable. Moving on to what I plan to do for next steps. First, I hope to be able to explore other different types of deep learning algorithms. Second, I hope to conduct a more rigorous literature review, for example, systematic review, which will require more time as well as more people to conduct such review. I also hope to explore what are some other types of functionalities that could be provided through the clinical decision support tool. And so the other things that could be provided are maybe different types of interventions and treatments that could be provided based on patient data that is input into the tool. And then finally, I also hope to submit an abstract, and this will give me the opportunity to actually evaluate these tools on an actual hospital system and see how well it works in improving clinician performance as well as health outcomes. So before I end, I would like to say my appreciation to the people who have provided support during my internship. And that's the end of my presentation. Thank you for listening. And are there any questions?